A lot of people are hearing about this new great American insurance plan that President Trump just released. Can you kind of tell us what this is about?
Yes, we could talk about it. Hopefully one day it's great, but right now I think there's some things that it lacks. And the whole, it starts always with, instead of giving the greedy insurance companies the money, we're going to pay it to the individual American family. They're going to use it to buy their health insurance. So my big question is, how does that reduce the cost of this health insurance? It doesn't.
Right.
If anything, what he's talking about is, instead of the government giving the tax subsidies to the insurance carrier directly, that's just going to go to individuals. Okay, so we don't know, or people could be getting a very large subsidy. Will that shrink? Will people who's getting just a little, will theirs increase? We don't know about that. And just ultimately, it doesn't lower the cost. It doesn't lower the fact that insurance carriers, first of all, they're regulated as to how much they can make. So how does that make them greedy? They're in a business that they can only make 20–25% profit. All right, and in that profit, they're using it to pay for all their expenses to run a business. 100 million, billions of dollars of money. So,
and there haven't been a lot of details released. It's not really a detailed plan as of yet. It's just
right. It's just a thought.
Yeah.
It does nothing to lower the cost for the insurance. Now, he mentions drug costs. Well, he's already doing that. He's negotiating, getting prices down for drug costs, right. Forcing other countries to pay more for their drugs.
Right.
So that in itself could help, but he's already doing that.
What worries you the most about this?
That it's not going to do anything to save it. We've been paying 10% plus for health insurance increases every year in this country for more than a decade, okay? And now we're seeing costs at 35%. So this isn't going to have the opportunity, paying money to us to buy our own insurance isn't going to reduce the costs.
So people are hearing about this, right? It's been on the news. What can people do if they have any questions? You're an expert.
Yeah, well, one of the biggest things that we want to do is help our clients save money, all right? Find the best plans, situations, everyone's is different, and we can help them at no cost. We're going to find out their doctors, their prescription drugs, talk about Medicare, talk about under 65 health care, and find the best plan for them.
All right, Mike, thank you so much
Thanks,
for joining
Liz.
us.